everybody. I am Dr. Sudhir Ganesan, Senior Consultant Ortho Spine Surgeon, Sri Ramachandra Institute of Higher Education and Research, Porur, Chennai. So this October 16th is being celebrated as the World Spine Day. So what is spine and why is it important? We all know the moment we hear the term spine or spinal cord or spine related pathology or issues, we tend to get scared. So the main and most important function of spine is to make an individual stand erect. So to create awareness about this important structure of our body, we are celebrating this Spine Day, World Spine Day. And the second most important function of the spine is to protect the spinal cord. And why spinal cord is important? We all know that it is the continuation of the brain and it is responsible for all the movements that we are doing. On this day, here are a few tips to prevent from you getting any spine related issues. Number one, as I already pointed out, spine is very important for maintaining your posture. So there are few curves in the spine which are named as the lordotic curves and thoracic and sacral kyphotic curves. The cervical and lumbar region has something called as the lordotic curves. So you have to maintain the curves in your spine. So because when an individual is standing erect, all these curves should be in an appropriate and erect posture. So when these curves are being maintained in a proper posture, the biomechanical forces that is passing through our spine will not be altered. As a result of this, the muscles and ligaments will not be in a compromised state and you can prevent getting mechanical back pain. And second thing, when these biomechanical forces are altered, it can result something called as disc degeneration. So what is a disc? We all know that the spine is made up of various parts of bone. These are called as vertebrae, and in between these vertebrae you have something called as the intervertebral disc. So as age advances, the disc tends to get degenerate because of various mechanisms, and one of the most important mechanism is biomechanical forces or stresses which is passing through the disc and the spine. So how do you prevent that? Again, by maintaining proper posture and by constantly strengthening your back and core muscles. Now you can ask me, how can strengthening your back and core muscles can result in decreased disc degeneration? So once you strengthen your back muscles, which is called as the erector spinae muscle or paraspinal muscles, and when you strengthen your core muscles or abdominal muscles, the entire load will be passing through your musculature instead of passing through the disc. Normally, the disc acts as a shock absorber. So when the load passes through the disc, it tends to absorb the shock and the load and it tends to spread it. So when the load passing through the disc is relatively less, it prevents the disc degeneration. So by strengthening your back muscles and by strengthening your core muscles, definitely the chances of disc degeneration is very less. And what happens when a disc degenerates? When the disc degenerates, it tends to come out and presses on the spinal nerves or the spinal cord. And when it presses the spinal nerve, you develop something called as the sciatica. What is meant by sciatica? You would have heard this term very commonly. I have severe pain in the back which is coming down to the leg. Yeah. When there is back pain and it is radiating down, or when it is coming down all along the back of your thigh and leg, it is termed as sciatica, and it is a red flag, which means that the disc has come out and it is pressing on the nerve. The next question which you can ask is, when should I meet a doctor? When I have a back pain, when should I meet a doctor? Suppose if you are getting a back pain all of a sudden, or if you are getting back pain after travel for a prolonged period of time, or you have lifted heavy weight and you are getting back pain, immediately what you can do is you can give ice pack fermentation, you can take bed rest for 1 or 2 days, and you can do some lifestyle modification by preventing from bending down or lifting any heavy weights and by avoiding forward bending and prolonged sitting. All these maneuvers will result in reduction in your back pain. Suppose if your back pain is persistent, severe, and it is continuous for more than 2 days, then it is better to consult your doctor to know what is the actual reason for your back pain. Some people will say that if you have landed up in back pain, you have to have continuous prolonged bed rest for about more than 1 week or 10 days. And it is strictly a no. Because the more you are in bed rest, your paraspinal muscles will get compromised and it will get on to a stage called as muscle wasting. So the moment you tend to mobilize after this 1 week or 10 days, your back pain will be aggravated and it can become a permanent issue. So bed rest is strictly not more than 2 days. So if you have back pain more than that, then definitely you have to meet your doctor. And other symptom or sign which points out that you have to go to a doctor is a leg pain or the sciatic pain which is coming down directly from your back along the posterior aspect or the back aspect of your thighs and legs. And when you have any weakness, that is if you feel weakness when you are walking, when you feel that you are not able to lift your ankle or toes, and when you have severe numbness of your ankle or toes, and these are all the red flag signs to visit your doctor to rule out other issues related to spine. The next common question which you can ask is, if I get a spine related issue, then will I need surgery? The answer is no. The literature suggests that 83 to 90% of the time an individual will definitely get at least one episode of back pain in their lifetime, and not all back pain requires surgeries. 80 to 90% of the low back pain doesn't require surgery, and 90 to 95% of the neck pain doesn't require surgery. And when do these patients need surgery? There are specific indications that require surgery. So the general myth that if I develop back pain or leg pain, I will land up in surgery is definitely a myth, and most of the times it can be treated conservatively without surgery. The next common question is, if I am being advised surgery, will I undergo paralysis after the surgery? And again the answer is no. With the technical advancements and the revolution in the field of spine surgery in the past 2 decades or 20 years, spine surgery has become very, very safe, and it has become a daycare procedure in most of the times. What do you mean by daycare procedure? That is, a patient gets admitted in the morning, undergoes surgery, and then the patient can be discharged the same day or the next day. However, it depends on the pathology for which the surgery is being done. For example, if it is a clear-cut lumbar disc prolapse surgery, now we have something called as minimally invasive and endoscopic spine surgeries, where the patient gets admitted, we do endoscopic surgery under local anesthesia. The patient will be very much aware of what is going on, and after the surgery for about half an hour or 1 hour, the patient will be made to walk to the ward and the patient will be discharged the same day. The chances of paralysis is almost nil in these type of surgeries. And last point about spinal deformity. What is a spinal deformity, especially in children? The spine actually has to be straight. It is a straight structure when you are viewing an individual from the front or face to face. Whenever there is a curvature in the spine, it is called as spinal deformity or scoliosis. The commonest type of scoliosis is called as the idiopathic scoliosis, which occurs in the adolescent age group, that is after 10 or 12 years. Because when the spine tends to curve, there is a growth spurt which happens between 10 to 12 years in the females and 11 to 14 or 12 to 14 years in the males. During this growth spurt, the spine tends to grow faster. That is why there will be a sudden increase in height in these kids. So that at that time the spine goes exaggerates its deformity and the child will present with the deformity. And now what to do? So how to identify that? Because between this 10 to 14 years, the child will also attain, the girl child will also attain menarche, and there will be a growth spurt and there will be exaggeration of deformity. And during this adolescent period, the children will not expose their body to their parents as well. So whenever there is an imbalance in the shoulder, that is when there is one shoulder at a higher level and the other shoulder at a lower level, then it is a red flag. It is imperative that these children should be shown to the spine surgeons or orthopedic surgeon to know what it is and to rule out scoliosis. We have come up with something called a scoliosis screening program, wherein we educate all the teachers in the school between 6th standard and 9th or 10th standard students. So the school teachers will examine the children's back even with uniform, and they will see whether there is any imbalance of their shoulders. If there is imbalance of the shoulder, then definitely those children must be examined by an orthopedician or a spine surgeon to rule out scoliosis. And if the scoliosis is identified at an early stage, definitely we can prevent the progression, and most of the times even if they need surgery, the surgery will be a very safe and secure surgery, and we can restore the spinal balance and we can restore the shoulder balance and the cosmetic deformity. So on this World Spine Day, I would request all of you to take adequate care of your spine and to lead an erect and a straight posture throughout your life without neck and back pain. Have a healthy day and a healthy spine. Thank you.